Hi, Dr. Ahmed with the Brain and Spine Institute. In this video, we are going to talk about a cervical arthroplasty, otherwise known as a cervical artificial disc replacement. Now, please keep in mind that these videos are meant for patients being treated at the Brain and Spine Institute of San Antonio, and that these videos provide a generalization. Each patient's experience may vary. All right, let's get started. Now, this surgery begins with a small 2 centimeter incision on the front of the neck, usually on the right side. Once that incision is made, dissection is performed through the muscles. You have to watch out for major blood vessels, including arteries and veins, and then you have your trachea and esophagus in the middle. Once all those items have been dissected, you get down to the spine. Once you're down to the spine, the disc that is causing the problem is localized, and it is removed in its entirety, leaving a space in between the vertebrae. Once that disc is removed, an artificial disc is inserted in its place between the vertebrae. The beauty of the artificial disc is that it is motion-preserving surgery, meaning that the range of motion of the spine is preserved and you can move normally after surgery. If you are having an artificial disc replacement, usually you can have either 1 or 2 levels per FDA regulation. Depending on how many levels are being treated, the surgery can last anywhere from 45 minutes up to an hour and a half. The surgery is done as an outpatient, which means you get to go home the same day. After surgery, you will have a drain that is coming out of your incision, but usually that is removed the very next day. After surgery, your first post-op visit will be at the 2-week mark. That's when we check your incision and we start physical therapy. The purpose of physical therapy is to regain range of motion, flexibility, and strength. After surgery, you will have a collar that you're going to wear for at least 2 weeks. As you start therapy and get stronger, the collar will be weaned off. Typically, around the 2 to 4 week mark, patients are doing well enough to where they are out of the collar. By 6 weeks, patients do not have any restrictions at that point. Patients are usually cleared to go back to work and start driving anywhere from 2 to 4 weeks after surgery. At the Brain and Spine Institute of San Antonio, our complication rate is less than 1%. I hope you found this video informative and helpful.